Welcome to the Feed Your Soul with Kim podcast. If you're looking to feel better in your life and want to feed your soul, you are in the right place. Here we believe life just doesn't have to be so hard. I'm Kim McLaughlin, your host. I'm a licensed psychotherapist, speaker, coach, and best-selling author. In today's podcast, we're talking about Eating Disorder Awareness Week. You might have an eating disorder yourself, or know somebody else who does, or just want to learn more about it. It's estimated that 9% of the US population, or 28.8 million Americans, will have an eating disorder in their lifetime. In this podcast, we're talking about what are the most common names of eating disorders and their symptoms, 5 signs to watch for to see if there is an eating disorder occurring, and 5 places to go to get eating disorder treatment. Let's get started. Hey everyone, we're going to talk about a very, very, very important topic today because I bet you know somebody, or even you yourself might have an eating disorder, or you might think you or somebody else has an eating disorder. And so in honor of Eating Disorder Awareness Week, we're going to focus on this topic and give you some really important information. First, I want to start that it's been estimated that 9% of the population, or 28.8 million Americans, will have an eating disorder in their lifetime. And this is a quote I got from the National Eating Disorder Association, which I'm going to link for you so you can go look up all of their information about eating disorders. And so eating disorders are serious, they're complex, and they're a mental health condition that affects a person's relationship with food, body image, and self-esteem. I want to start with telling you about different types, the main diagnoses of eating disorders from the DSM TR5. And that is the diagnostic statistic manual that therapists use, that providers use to have a shared language about eating disorders. So the first one you might have heard about is called anorexia nervosa. Anorexia nervosa is characterized by extreme food restrictions, intense fear of weight gain, and a distorted body image. Next, there's bulimia nervosa, and it involves cycles of binge eating followed by purging, which can be vomiting, excessive exercise, laxatives. And the third one that you've heard of, which I talk about a lot, is binge eating disorder. And it involves episodes of consuming large amount of food in a short period of time with feelings of guilt, but without the purging. So you're eating food, not feeling happy with yourself, and just don't like the quantities that you're eating. There's lastly avoidant restrictive food intake disorder, and it's about limiting food intake due to sensory issues like the fear of choking, the lack of interest in food, and not related to body image concern. And you've seen a medical doctor, and the doctor has said that it's not about a physical problem. So the causes and factors of these these eating disorders are all very different. So when I talk about causes and risks, when I talk about what they look like, each of them look different, and each of them are very nuanced for individual people. So take this information and put it together and see if any of it fits very well or a little bit. And then it would be important for you to seek out help to figure out what you can do about it. So the causes and risk factors of these various types of eating disorders arise from a mix of genetic, psychological, social, and environmental factors. Like there can be a genetic predisposition. We know that with eating disorders, it runs in families. So there are genes attached to it, but that's not necessarily the sole factor involved in an eating disorder. There are often quite a few. Others can be trauma or past abuse, societal pressures, and media influence. We see this a lot around dieting and restriction and what kind of foods you should and shouldn't eat. It gets very confusing about what kinds of foods you should and shouldn't eat. And especially if you have an eating disorder, it becomes really tough to figure that out. And then there's also perfectionism and high stress. So you can see that this is a large mixture of different kinds of areas that come into play in terms of eating disorder. I think it's also really important to talk about there are what we call co-occurring mental health disorders. So that means two disorders existing together. So that can be a mood disorder, like depression can coexist with any one of those eating disorders. It can be anxiety disorders can exist with any one of those eating disorders. And it also can be substance abuse exists with any one of those eating disorders. Sometimes there's even more than one or two diagnoses. It can be multiple. So it can get to be very complicated and nuanced in terms of what's really going on for the person. So there are physical and mental health effects. I think you know that about eating disorders or that go along with eating disorders. There are things like heart complications. There can be digestive issues, tummy issues, and metabolic disruptions, a weakened immune system, or just not feeling well in your body. There can be osteoporosis and weight loss, and there can be cognitive and emotional distress. So when we know that it can show up in a physical kind of component, we should have some things that we should start watching for because you might wonder, like, so if I have this problem, then what do I start? If I think there's a problem, what do I start looking for? And here are some signs that I think can help you figure out or begin to go in the direction of figuring out what might be going on. Some signs to watch for are an obsession with food, an obsession with dieting, an obsession with body weight. And that is involved in all of the diagnoses. Remember, we talked about there are a lot of different diagnoses. The food can be restricting of food. The avoidant restrictive food intake disorder can be I don't like this kind of food. And so a whole food group can be off the table. Binge eating disorder can be these are the foods that I binge on or the foods that feel triggering to me. Also, the same with bulimia. These are the foods that I can't accept in my body or have allow myself to eat and keep those foods down. So this is an obsessive thing with food, dieting, weight loss, getting on the scale all the time, starting to see on a daily basis, multiple times a day, checking in on your weight. So that's one of the signs to watch for. And it could be any one of those eating disorders that are showing up for you with this obsession with food, dieting, and body weight. Another sign to watch for is a dramatic weight change, either increase of weight or decrease of weight. Any one of those can be a sign to watch out for. And I really want you to look at this that if you have an extreme weight gain and if you have extreme weight loss, go to your doctor because there can be something physically wrong. We're talking about with these eating disorders, we're talking about the psychological components of it, but there can be a physical disorder, a physical problem, a physical issue that shows up in that increased weight or decrease in weight. So please make sure that you go see a doctor to have yourself checked out. Other signs to watch for with eating disorders is social withdrawal and secretive eating behavior. I talk about a lot with binge eating disorder is it can be about hiding when you're eating, hiding the wrappers, but that can also show up with binge eating is hiding the food and overeating it and then purging it. So this, once again, the social withdrawal and secretive eating behavior can show up in all of the disorders. There's also some signs to watch for, and I think one of them you'd be surprised about is excessive exercise. Excessive exercise movement, I like to call it, not exercise, movement in and of itself is really good. Going to the gym, having a regular plan of how you're going to be active is really good. But there is a point where it can be excessive and it's part of a problem. I remember when I was in college, part of my eating disorder was to excessively exercise. And it would be to the point where I would almost pass out partly because I didn't have enough water, I didn't have enough food, but I was over exercising and using that as a way to manage my body weight. So excessive exercise is one thing to look for that you don't always recognize as something to look for. The second that I think you do know to look for is excessive laxative use. And that is extremely concerning. It is causes physical problems. So if you're using laxatives to get rid of food, to let go of weight, that is a serious medical concern that it is important to go check that out with your doctor, because if you're having problems with the restroom, with elimination, then is it about that there's a physical problem or is it a psychological problem, including an eating disorder? So please make sure to watch for that. That is extremely dangerous. And we need to have elimination done in a natural process. And if that's not happening, we got to check that out. The other thing that to look for, a sign to watch for, is frequent bathroom visits after meals. And that would be about purging, whether somebody is going in to purge the food that they just ate. And I've heard lots of stories in my practice from people with bulimia where their family members hear them or they talk about the shame that they have about purging and being pretty certain somebody heard them, but nobody says anything, or in a public restroom where they're trying to muffle the sound. So I know that that doesn't sound, that that can be something that you might feel off put by me saying this, but we've got to talk about this. We've got to talk about it. If you're having frequent bathroom visits, if other people are, if you're purging, then we need to talk about it. We need to do something about that because that is a serious problem. Food is meant to go down. It's not meant to come back up repeatedly. That's just not how food is supposed to work. The other thing to watch for is that those co-occurring disorders, the mood swings, the anxiety, the depression, and then you put it together with any kind of food issues. We really want to look at that, and we want to give you kind of this well-rounded approach to look at all of that because a lot of times eating disorders don't appear in isolation. They appear with other kinds of difficulties going on. So really pay attention to that. So we've talked about the diagnosis, what to look for, the physical components, the signs to watch out for. And then I think you probably are wondering, well, then what the heck do I do about this? And there are lots of ways, there are lots of places to go get help. I am I'm on lists for eating disorder recovery centers that are all over the country. They're everywhere, and some are private pay, some are out of pocket. There is a place to go, and you just need to seek out some person who can help you direct you in the right place. So there are medical and nutrition support in facilities, especially when you're dealing with a physical component that goes along with it that has to do with, especially when you're underweight, we need to increase the opportunity or have you have a medical look at that. So there are lots of places to go that have medical and nutritional support. There's also outpatient medical and nutritional support. So that what I'm talking about is more inpatient kind of support. There's outpatient kind of support that does have a therapeutic component that then can offer in medical and nutritional support on an outpatient basis. There are lots of different kinds of therapies that work with eating disorders. And really, I think what it comes down to is look for a therapist that is trained to work with eating disorders. I myself am I have an eating disorder certification. So I went through a whole I don't know how many hours. I spent a lot of hours and a lot of education units at college, master's level college classes that gave me this certification. So look for somebody who is certified in eating disorder treatment. Also, anybody who is a licensed mental health professional who is also certified as an intuitive eating counselor. Those are two good things to look for, that somebody is qualified to help you out. You don't want to go to just anybody when you focus on eating disorders because you need to have somebody who knows what they're doing. And if you're with a therapist right now, or you know somebody with a therapist, um, really good therapists will refer out. They'll say, this is beyond my scope of practice, and I'm going to refer you out to an eating disorders therapist. I have that happen a lot where I have somebody's been seeing another therapist and they get referred to me for the eating disorder issues. So just know that a good therapist will help you get to the right spot with a certified eating disorder specialist. Other areas for support is family, friends, support groups, places where they know what they're talking about. So it's really important to get help, to get that service, that treatment, or talk to people who know what they're talking about. They're oftentimes family and friends might not be the best people to talk to because they talk more about their issues or what they've done around overeating or weight loss or how to gain weight. And it's not with the really nuanced perspective of, is this an eating disorder? So really watch out with them. There can be people that you know that have had services, and where have they gone? I think that's a great thing to ask of your support system is, where have you gone for help? Who's a qualified mental health professional in your area that can help you out? Also know that there are support groups in lots of different eating disorder clinics that will help you. There's also 12-step groups, and those can be very helpful. Back in the day when I started in eating disorder recovery, I went to 12-step programs, and I think it's really being um, mindful of going to a 12-step group that is focused on recovery and not telling you what to eat. There are a lot of 12-step recovery programs focused on eating that actually tell you what to eat, and that's just them giving you a diet, and they're not dietitians. And I don't think that is the best place for you to go. So really be mindful about where you go in terms of support places, but they can be really helpful to get you to your next place, the right place for you to go. Also, know that there can be medication that is going to your doctor, talking about your symptoms and talking about what kind of medication might be helpful for you. And I'm talking more about antidepressants, anxiety medications, things to kind of help you feel calmer so that you can make different decisions with food and feel like you're more in control or more empowered when it comes to food. It's interesting that when we talk about eating disorders, I just want to do a little myth busting, okay? That there are certain things that people think or that are said in our society that are not true. And I just want to kind of put out the word that these aren't true. So here are some of them. One of them that I hear all the time is that anybody who has a higher body weight has an eating disorder. And I want you to know size in and of itself is not indicative of an eating disorder. Even somebody who's on the smaller side, it's not indicative of an eating disorder. So don't pigeonhole people in because of the size of their body or shame them because of the size of their body. You don't know what's going on to know if that is an eating disorder or not. Um, a second thing that comes up that is a myth, another myth is food disorders are about food, that it's about what you eat, when you eat, how you eat. And as we've just been talking about, eating disorders are really, really complex. It's not one person told me like, oh, if you have an eating disorder, all you should do is just put your hands behind your back and don't eat. It's like, wow, a shaming kind of perspective. And it's not just about the food. I always say food is one of the components, right? I talk about there being 6 components. There's the physical, which includes food. There's emotional, there's mental, there's lifestyle, there is mindfulness, and there's self-love. And within those 6 components, there are a lot of subcategories within them. It is not just about the food. That's why just taking away the food or dealing with the food doesn't stop the problem. Eating disorder continues. We have to do a broader based approach rather than just look at the food. There's also the idea that recovery or working on food eating issues is about eating more food or eating less food. And that goes back to the idea that it's about the food. And it's not about eating more or less food. It involves that social, emotional, psychological, behavioral patterns that really make it difficult for people. Um, and also that eating disorders are only for white women. Um, and what we know is that eating disorders are not about the white population. It is all ethnicities have experienced eating disorders, all ethnicities. So it is not just a disorder for white people. And it is not a disorder that just is for women, that women are the only ones who have it. It's just not true. Men have um, a high rate, higher than you think. I don't have the statistics right in front of me, but there are men who have eating disorders. So don't discount that men don't have eating disorders. And our LGBTQ community also experiences a lot of eating disorders. So it's it's all people have it. Eating disorders don't discriminate. It can happen to anybody. So this leads, I think, to you wondering then, what do I do if someone I love has an eating disorder? If someone you love has an eating disorder, I actually wrote a whole medium.com article on it, and I'll put a link to that. And I also did a podcast on it, what to do with someone you love. There's a lot of things you can do. So let's just kind of narrow in some ideas. Approach them with compassion, love, let go of the judgment. Avoid commenting on their weight and their dieting and their appearance. This feels shameful. To people with an eating disorder, the focus on their weight is is a shaming kind of way to approach them. Really what you want to do is approach them with love. Approach them with love, compassion, non-judgmental. And it really is something that you just come from your heart when you talk to them. Come from your heart. What I think the biggest thing is to encourage them to seek out a mental health professional, somebody who is qualified to help them with what's going on. And you can help by offering to drive them, to help them find resources. I always say that if you're in if you call me up and you're a family member with somebody with an eating disorder, I'll help you figure out some words. So call local therapists, ask them to help you come up with some words to talk to somebody about it. It's hard to support somebody who has an eating disorder. It is hard. I get it. It's hard for the person with the eating disorder, and it's hard for the family member, the loved one, to watch it. And really, lastly, with all of that, I want you to really consider being patient. It's a process to move through an eating disorder. It's not a one and done. That's why diets don't work. That's why diets don't work. That there's this thought that if I just restrict my food, if I just put my food in this right order, I won't have an eating disorder. And it doesn't work that way. So be patient with them and with yourself, and come again with non-judgment, compassion, love. Those are the best things to do. And to just say, I want to be helpful. What do you need from me? Or how can I be helpful to you? The biggest thing is to seek out a qualified mental health professional. Eating disorders are dangerous. There are things, people die from eating disorders. It's serious. So seek out a qualified mental health professional. I'm going to put a link in the notes about the National Eating Disorder Association so you can contact them. Please feel free to contact me, send me an email, and I can help you find the right person, or at least steer you in the direction of a person that can help you with an eating disorder. Eating disorders are serious, and you deserve help, or the person you know deserves help, the right help to help get you through this. I just want to say that in honor of Eating Disorder Awareness Week, I am happy that we were able to get some information. I hope that this helps you get a little bit of clarity on what's going on and some ideas about what you can do to help yourself or help somebody else with this. Thank you guys. I'll talk to you later. Bye-bye. Thank you for joining us on the Feed Your Soul with Kim podcast. We love bringing you fresh content to help you feed your soul. We would appreciate it if you would subscribe and leave a comment about our podcast so others can find us. This podcast is not a replacement for mental health counseling. If you are suffering, seek out a qualified mental health provider. You are worth it.